Welcome, everybody, to today's podcast show. My name is Saad, and I'm a member of the global grassroots movement called Students Against COVID. We're a group of students and allies from 45 plus countries and counting, made up of 120 plus members collaborating and brainstorming ways to combat the current pandemic. As you know, our podcasts are all about alleviating voices during these unprecedented times. So your voice matters. We've had very inspiring and interesting guests on our show so far. And today I'm honored to introduce to you our next guest, a survivor of the disease that's taken over the world by surprise. Faiz Ilyas from Bradford, UK. Mr. Faiz unfortunately contracted the virus and spent some time recovering in the ICU, which must have been extremely frightening for him. So welcome, Mr. Faiz. It's a pleasure to have you on our podcast and see you in good health. I'm sure in the last few months you must not have been the best, and hopefully you can provide our viewers with some insightful advice.
Yeah, thank you very much for having me. I'm looking forward to our conversation.
Okay, so we asked our viewers some questions. We asked our viewers to send in some questions, and the first thing that they wanted to know is, how originally did you find out that you contracted the virus? Because we hear different people talking about different symptoms that they had. So what were some of your first initial symptoms and how did they develop over time?
So basically, it was a Sunday evening, I remember, and I had a really high temperature. And I've had fevers before, but this was like you could tell this was something serious.
Mm-hmm.
And that was my first symptom. And as the days went by, I started to develop a sort of like breathlessness, but that became more apparent on like the fifth or sixth day. And I never got the cough, which a lot of people
Really?
talk about. I never really got that, no.
Oh, okay.
Which was a bit weird, and like that's when I always used to think in my mind that maybe I don't have the virus then. Maybe it's just like passing temperature or just a bit of a cold or something. But then another thing that at the time we didn't know this was a symptom, but I got this really horrible taste in my mouth, which some people describe it as a tasteless taste, but for me, it became like a horrible taste in my mouth. And it was
Oh,
like a burning oil. Like, you know, when you burn dirty oil, you cook with dirty oil, it would
yeah.
have this smell. That was constantly in my mouth and in my nose, and it was horrible. Like, and I wasn't eating already at that point, but that was another like sort of a symptom that made me feel like I couldn't eat at all. Then, like, even if I saw something I wanted to eat, I couldn't eat it. And another thing that I would get like a gagging sort of feeling of like every like half an hour, 15, 20 minutes, I'd want to like sort of vomit. But because I wasn't eating anything, nothing would come up. And then eventually, like, it was like started to become like phlegm and blood. And that was what I was vomiting. And I didn't really know that I had the virus properly because my dad was ill at home as well. But he went into hospital and he came back and they tested him and they said, you don't have the virus. Now,
Oh,
and although he was displaying all the same symptoms I was and everything, when I went into hospital, I kept thinking to myself, maybe I don't have it. Maybe it's just like something me and my dad have caught and it'll go away. And when I went into hospital, I think it was when I went, basically after a few hours, they took me into ICU. And that's when I knew that, yeah, this is what this is. Because they took me to the coronavirus positive ward and then they took me to ICU. So that's when I like knew, okay, this is what I've got then.
oh, wow. I can't imagine how that must have been. Can you talk us through the whole experience of what it was like being admitted into the ICU and as far as the NHS and the emergency services coming to your house, or if you went to the hospital and how the whole experience was like for yourself?
So as I said before, I felt that temperature feeling on the Sunday evening. So on the following Thursday, my mom and dad they called for my mom and my wife actually called for an ambulance for me. And at the time they came to our house, the paramedics. They uh, looked at me and they said to me that look, you're still manageable and you manage your symptoms at home. They tested my dad at the time. My dad went into hospital. At the time, those paramedics that came, they had like all this sort of really highly protective PPE equipment on, and
Hmm.
it covered their whole body. They had like this big mask on. It had like this pipe that was like filtering oxygen for them, and that's what they came in. And that was a bit scary at the time to see that.
Yeah, I can
Um,
imagine.
but then on the Sunday, that's when I actually went into hospital. Sunday night, Monday morning. And at the time, my mom and my wife, again, they were contacting NHS 111. And they were also contacting 999. And it took them 12 hours to actually manage to get some paramedics out to me,
Oh,
which was really long. I think they started at like 2 o'clock in the afternoon on Sunday, and an ambulance didn't come out till about 2 a.m. on Monday morning. Now, straight away, the first thing I noticed was these paramedics, they had none of the equipment the previous paramedics did. They only had like a face mask on, and I think they might have had some gloves on. So that was instantly, that's something I always remember now, like that there was a shortage of equipment. There wasn't enough equipment at the time, and maybe the response wasn't as good as it should have been. Anyways, they took me into the hospital accident and emergency room, but they took me in a completely different way than I've normally ever been. When I've ever been in before, I've never been this way. They took me in through some side entrance, and straight away I was put into some room and I was isolated there, and I was taken by myself as well. So that was the first moment of like knowing that something serious is going on here. And then all the staff that were coming to see me, they were wearing protective gear. Normally, if you need to do an X-ray, they take you to a different room. This time I wasn't. They brought some machine into the room and I was given an X-ray there. And eventually I was asked if I'd like a family member to be with me. And because the hospital was still allowing family members in at the time. And I said, yes, please. And at the time, my sister came. And I was in bad shape at that time. Like, even now, I felt like I was only in there for a couple of hours. And my sister reminds me that I went in there at 3 a.m. and I didn't get out of that room till 11 a.m. And that's when I was put on, basically, I was put in an isolated room by myself in Ward 31 of Bradford Royal Infirmary. And that was basically the coronavirus positive ward. And whilst I was in there, a number of doctors came to see me, and they were trying to basically find my arteries, and they were trying to basically connect some tubes and stuff there, and they were failing to do that. And I think about 4 doctors were attempting to do that. And that's when I think they got really worried, and that's when they made the decision to take me into intensive care. And I was rushed. And at the time, actually, my mum managed to come to see me as well. But then, as soon as I was taken into ICU, at some point, basically, the hospital decided to shut the entire hospital off to any visitors. So no family, nobody was allowed. So when I went into ICU, I was completely alone. And the first thing I noticed when I went into ICU was it was empty. There was nobody else in ICU. So all the other rooms were empty. And I was taken in. And straight away, the doctors started to they put my arms to sleep, and they started to find my arteries, and they got all these pipes connected to me and tubes and stuff. I was lucky. I was never put onto a proper ventilator, the one that where you have to be put into a coma. I was never put into that.
So while you were in ICU, were your family members able to contact you in any way, such as a phone call maybe, or anything like that? Did they have to call 111 to contact you?
So I knew that my family, they did get in touch with the ICU ward, and they would speak to the doctors and nurses there, and they'd get updates. I did have my phone with me, but I think I was lucky in the sense that my charger was only a very short charger. There was no plugs near me. So my phone was always away from me. But on an evening, I'd ask one of the nurses to pass me my phone. And so on the second day, I was like, in the evenings, I would start to speak to my family and a few close friends and just reassure them that I'm doing well. But it was scary. I think in hindsight now, I think when my family saw me on the video call and stuff and seeing all these equipment strapped to me, I think it might have maybe made them worry more, to be honest.
Yeah, it must have been really scary for them. Moving the conversation backwards a little bit, one really important question that loads of people had is the majority of people are told to stay at home if the symptoms aren't too bad, and told to simply just take paracetamol, not even ibuprofen. So being someone that has experienced the most severe side of the coronavirus, were you given any other medication to help with your situation while you are at home? or were you told the only thing you could do is wait it out and hope for the best, or eventually end up as in ICU as unfortunately you had to?
So whilst I was at home, I was taking paracetamol, and I wasn't eating anything, but I was taking lots of liquids. I was drinking loads of dilute orange juice, water. I was drinking blackcurrant juice and all sorts. But yeah, to be honest with you, it was kind of strange, like knowing that you're ill with something so serious, and the only thing you can do really is take paracetamol to control the temperature and wait
Yeah,
it out. And even when I was in hospital and I was in the ICU, and there was nothing really they were giving me that was anything else apart from the oxygen.
yeah,
I think there was pressurized oxygen that they were forcing down my lungs. Apart from that, I was on some antibiotics, and I think those were to help clear up my lungs. And I was given paracetamol I was regularly given paracetamol to control my temperature, and occasionally they'd give me morphine as well. But beyond that, there was nothing like specific, and that was a weird feeling because there is no cure for this virus, is there? So
true.
so you just have to fight it out.
I mean, it must have been really scary going through something that the media always portrays the number of deaths for on the news. So
Yeah.
how did you keep yourself positive through this time of crisis? Because I can imagine you must have been really scared, especially knowing that you're going through something where, everyone literally just talks about the number of deaths for.
I think, on the first day it was really difficult. I thought I was gonna die. When I on that first day I went into ICU, like I was really scared. And you get to this point where you start worrying about your family, and you start thinking, oh,
Yeah.
what's gonna happen with them? I'm grow young, my family's relying on me, all that type of stuff. And then you get to a point where you start to come to terms with it, and that was really scary. But after I had this mask on me at the time, I remember, and it was on for about 12 hours, and it was like a sealed mask. They were forcing the oxygen down me. It was
Yeah.
pressurized oxygen. Now, after that was taken off me, and like my oxygen was reduced, and like doctors were coming to me and saying that, oh, soon we'll be moving you to a normal ward and things like that. That's when I started to feel happy again. And then you see all your messages from your family, and you see them from friends. And I remember some of my family, extended family, shared on social media that I was ill, and I got so many well wishers and people, and just to know that like you've got so much love out there, that just like um, drove me through it. And like I'm so thankful to all those people. And I think one of the other things was, whilst I was in ICU, the amazing NHS nurses, like the care they give you,
Mm. Yeah.
like it's amazing. Like they are so underpaid. Like you are in your most vulnerable state, and they are coming and they are tending to your every need. Like I remember when I was scared on that first night, I asked the nurses like, please don't leave me, and like they put their lives in danger, just stay in there and hold my hands basically whilst I was in there. And that was really scary. And like I'm just thankful to those nurses that did that
Mm.
and stuck by my side.
Yeah, I can imagine. We definitely need to appreciate our NHS much more. Another question that they had was, in the beginning, many people have doubted the capability of social distancing in reducing the rate of spread of this infection, which hopefully everyone understands the importance of now. Besides
Yeah.
social distancing, did you get any other advice from the doctors after you were discharged and allowed to go home?
Yeah. So one of the things was, first thing was, there's a lot of exercises that you can do,
Mm.
because one of the things that this virus sort of attacks is your lungs, and that's where the breathlessness comes from, and that's what's actually really fatal for a lot of people. A number of the people that I know that have already passed away from the virus, their underlying condition was asthma, right? So they're
Hmm.
already weaker lungs. And basically just keeping those lung exercises, basically sitting up straight, breathing in, holding that
Yeah.
breath in there for a short while, and then breathing out slowly. Like it helps so much, like filling up the bottom of your lungs. Like you don't realize how big your lungs are, and sometimes we're not using them all the time.
Mm.
And that was something that was really good. Also, I'm a part-time taxi driver as well as student. And whilst and basically whilst I go back to work, just to wear some sort of protective gear. So I've purchased some masks, and a friend of mine donated some to me as well. And I've got hand sanitizer as well now. and a bit of a cleaning equipment as well. So when a passenger leaves, so just taking those
Yeah.
small steps, just a few extra precautions, just to make sure you're safe and your passengers and the community and the public is just safe.
Yeah, I think it's really important to have our personal hygiene on check because especially working a job such as taxi driver, you're going to be dealing with so many people every day, and your hand sanitizer, your mask, those are going to be your saving equipment that you really need for yourself. Finally, to end this podcast, the question we wanted to ask is what positive message do you have out there for our viewers who are tuning into this podcast or people who are suffering with the coronavirus right now?
I think if you're suffering from the virus right now, I think remember more people are surviving it, vastly more numbers, right? And
Mm,
remember, it's only a very small proportion that are actually passing away from this.
mm.
I'd say stay positive. Remember, you've got plenty of people that love you, and you just need to fight and pull through on this, and hopefully you'll get well soon. I think one of the message I'd like to give is just to the NHS nurses and doctors. I think they do a fabulous job. I think it goes unthanked a lot of the times, and it's a good opportunity to say thank you to them. And I'd like to say that thank you very much.
Okay, so with all the tragic things that are happening in the world as a result of the coronavirus, now might seem like an unusual time to talk about being positive. Yet, staying positive is a core ingredient in the recipe of successful coping in a crisis like this, now more than ever. So, Mr. Faiz, we'd just like to thank you for taking a valuable time today and talking to the students against COVID. We truly appreciate your support.
Thank you very much.
Okay, have a good day.